I will be demonstrating the skill of measuring and recording manual blood pressure. Before I go into the room, I will knock.
Come in.
Thank you. Come in. I'll wash my hands. I will introduce myself. Hello, Miss Lisa. My name is Ann. I'm your caregiver today, and I'd like to take your blood pressure. Is that okay with you?
Yes.
Great. And you see that my hands are clean, right?
Mm-hmm.
I will provide privacy, and I will ask my instructor who is evaluating me to come in and to monitor and listen as well. I will have Miss Lisa put her hand out, palm up. I've washed my hands. I will also gather my equipment. The day of the skill, you will be using a stethoscope that has the 2 earpiece sets, one for yourself as the candidate and one for the evaluator. I will hand the evaluator her piece. She can clean hers off. Thank you. Welcome. And I can clean mine off. Cleaning the earpieces off first. Then cleaning off the diaphragm. If the earpieces bend forward, remember we always put them in our ears so that they're pointing this way. Please put them in your ears so that I can check to make sure that my diaphragm is open. Yes, it's open. I always tap on that so I can hear and make sure. Now I'll take them out of my ears so I don't accidentally bang this on anything. Keep them around my neck though. At this point, I will make sure that Miss Lisa's hand is palm up. I will figure out where her brachial artery is, and that is above the bend of her elbow on the inner aspect. We'll use 2 fingers, the tips of my fingers, palpate that brachial. I've palpated it. I don't need to do anything else other than to feel it. Now I know where to put this arrow, placing that right above the brachial. Putting the cuff on snugly, making sure it's not too loose. This arm is okay to take your blood pressure in, isn't it?
Yes.
Great. You should always make sure that for safety reasons that we ask the resident or the patient if this arm is okay. At this point now, I'm going to place my diaphragm underneath that artery arrow. I'm going to place these in my ears with my evaluator. Quite a few things to do at the same time. I will be holding with my 2 fingers the diaphragm in place over her brachial artery. I will then also tighten my blood pressure bladder. Tightening this to the right would allow me to pump it up. I'm only going to pump it up between 160 and 180. Do you want to come closer? So tight goes to the right. That's the only time I'm touching that for now. I'm going to pump up. Never going past 200. I did hit that 180 right now. I'm going to turn to the left to loosen the dial. Listening. Letting go of the dial until I hear the first number and the second number. Releasing it all the way. Taking my earpieces out.